The outbreak of the coronavirus disease, or COVID-19, can be very stressful and create a lot of fear and anxiety in both children and adults. Coping with this stress and paying attention to our mental health needs are more important now than ever. Everyone reacts differently to stressful situations. How you respond may depend on your background. Maybe you've experienced some trauma or have had very serious health issues. Your own personality and temperament. People who are more sensitive tend to respond to situations more strongly, as well as the community and the support system that you have around you. Generally speaking, people who may react more stressfully to this crisis could include older people and people with chronic diseases who are at higher risk for COVID-19. Young children who have less understanding of the situation. People who are helping with the response to COVID-19, like first responders or social workers or educators, doctors, healthcare providers, and mental health professionals. People who are responding to this need often experience secondary trauma or vicarious trauma as a result of witnessing the traumatic effects that it might have on others. In addition, people who have mental health conditions that might include issues with substance abuse and/or have had a history of anxiety or depression may also react more strongly to this current situation. Some of the effects of stress can create disturbances in eating and sleeping, health issues becoming worse, and increased use of alcohol, tobacco, or other drugs, as well as tension within relationships with loved ones. It's very important that you practice self-care and that you watch over toward your family and friends, even if reaching out to them by phone or FaceTime or Skype call, or maybe even sending a note in the mail. There's no reason you can't go old school in reaching out to other people. You can look for areas that need extra help, extra groceries, extra water, even extra toilet paper, and perhaps drop off some stuff on their doorstep and let them with a little note. This is the time for focusing on gratitude and looking for acts of kindness that you can do towards other people around you. Be sure to take breaks from watching, reading, or listening to news stories, including social media. The more you hear about the pandemic, the more upsetting it can be to you. Take care of your body, take breath, stretch, or meditate. Try to eat healthy, get exercise, plenty of sleep, and avoid excessive alcohol, drugs, or caffeine. Do little activities that you enjoy. Practice working on hobbies, reading a book. Anything that might provide you with a healthy distraction and allow you to perhaps learn a new skill, to start journaling, to paint, to learning a new language, to take an online course. There's so many things that you can do during this time that can still be very productive and provide you with emotional and mental growth and mastery. This can be a very difficult time for parents who are at home with children for extended periods of time. Children can become easily bored, begin irritating one another, irritating mom and dad, and or fearful about the news and events that they're hearing. Some of the responses that children might have to stress would include excessive crying or irritation, some regression in behaviors to younger ages, maybe even having toilet accidents or bedwetting, irrational fears or worries about the world ending, inability to sleep or eat, difficulty with their attention and concentration, avoidance of activities that they've enjoyed in the past, unexplained headaches, or even body pain that are unrelated to any type of actual illness. There are many things that you can do to support your child during this time. Take time to talk with your child or teen about the COVID-19 outbreak, answer questions, and share facts in a developmentally appropriate manner. It's often useful to talk about the headlines without going into all the nitty-gritty details. Reassure them that they are safe, and let them know that they will be okay, even if they feel upset sometimes. Admit that you might feel upset too. It'll help normalize the situation. Share with them how you are dealing with the situation so that they can learn to cope from you. Limit your family's exposure to any news coverage of the event, including social media. Children can often misinterpret what they hear and become irrationally frightened. Try to keep some regular routines. Do some schoolwork. Practice doing some chores around the house. Work on some projects. But also allow for some flexibility, some fun. And as we mentioned before, look for ways that you can engage in random acts of kindness. Most importantly, parents are the role model. Children will follow your example. If you are calm, they will be calm. If you are frantic, they will be frantic. Take care of yourself so that you can take care of your family.